Hello, my name is Mackenzie Rosner, and I'm a student nurse at the University of South Alabama, and today I'll be performing the IV saline lock checkoff. So, show my badge, and she's going to scan the room. So upon entering the room and perform hand hygiene, I'm going to verify the hospital policy and the patient's order form. And I'm going to use the form to identify my patient using two identifiers. So I see this is Jaguar Jones. Jaguar Jones, he was born on 8/25/1963, 8/25/1963. I see that he has an allergy to penicillin and he has an armband for that, and I would make sure that there were not any other allergies at that time. And then I'm going to explain the procedure to the patient and provide privacy. So now I'm going to gather all my equipment and position my trash can close to me. After doing that, I'm going to perform hand hygiene and put on my goggles. After doing so, I'm going to raise the bed to a working height and lower the side rails. I'm going to put my patient in a supine or sitting position and maintain privacy while doing so. And now I'm ready to open up my packages using aseptic technique. Opening them away from me. Now I'm going to prepare my tape. So now I'm ready to cleanse the saline lock cap. So I'm going to not touch the white part and use my alcohol swab to clean that and then dispose of it. So now I'm going to grab my saline syringe and remove the cap from that, put that to the side, and I'm going to prime it over the trash. And then connect it. And now I'm going to prime the tubing. Okay, now I would loosen the cap and set it back in the packaging. So now I am ready to, I'm going to move the needle close to me and the tegaderm for later. And I am going, now I'm going to explain the three principles when selecting a vein. You want to use patient's non-dominant arm and choose the most distal vein. Choose a large and spongy vein and avoid bruising. To foster venous distension, you want to lightly stroke the vein. You can apply warmth for vasodilation, and you want to make sure the extremity is in a dependent position. So now I'm going to apply the tourniquet. And I'm going to apply this on the patient's arm 4 to 6 inches above where the site will be. And I want to do this tightly in a quick release knot. And now I will assess for the vein appropriateness and check the patient's radial pulse. Okay, so now I can put my clean gloves on. I'm going to move the saline lock closer to me for later. And I'm going to cleanse. I'm going to activate the ChloraPrep and then I will vigorously clean in circular, vertical, and horizontal motions. will dispose of that. So then now that I've cleansed, I am ready to, I'm gonna uncap my needle, and I'm going to anchor the vein 1.5 to 2 inches below where I'll be inserting. I'm gonna not touch where I've just cleaned, and I'm going to instruct the patient to stay still, and it'll just be a quick prick. And I'm going to insert it with the bevel up at a 10 to 30 degree angle. And I'm going to insert until I see blood return, and when I see blood return, I'm going to lower the needle and then advance it another 1/4 of an inch. So now, once I advance it, I'm going to advance the catheter until the hub. And then pop the stabilize the catheter and pop the tourniquet. Then I am going to apply pressure 1.25 of an inch above the insertion site and remove the needle. So now I'm going to apply pressure still and connect the saline lock. So I'm going to continue applying pressure, and I am going to use tape to secure my. Now I can release that pressure, and I'm going to use my syringe, and I'll aspirate first for the to see blood return, and then I will blush saline into my tube, and I would normally use all the saline, and I'm going to be observing this site for any swelling. So now I'm going to remove the syringe and dispose of it into the sharps, and now I am going to apply the dressing and dispose. I'm only going to touch the paper, and I'm going to put this up to the hub. Make sure it is stuck down, and then I'm going to remove the paper off the top. Make sure all the edges are stuck down, and I'm going to keep put that to the side. Now I'm going to remove this tape and apply a new piece of tape that will secure the tubing at its natural position. There we go. Now I will dispose of my things and remove my gloves using glove to glove skin technique. And I am going to prepare my label. I'm going to write the date, the time, the gauge, and initial and the name. I'm going to apply that to the edge of the dressing, making sure not to cover anything. Then I would replace or reposition the patient in a safe and comfortable position. I'd lower the bed and raise the side rails, and now I'm going to instruct the patient of the signs and symptoms of any complications with an IV and how to prevent dislodging of an IV. So signs and symptoms would be infiltration, inflammation, and phlebitis. To prevent dislodging, I would instruct the patient to notify the nurse if they notice that the flow rate had either stopped or slowed down. to also notify the nurse if they notice any blood in the tubing or on the dressing. And I would encourage them to protect the site when moving and to wrap it before taking a shower. So now I would perform hand hygiene, and then I would document this procedure. I would document the date, the time, and the location of the site, the number of attempts, the catheter length and gauge, the patient's tolerance. I would document the presence of the saline lock or the flow rate, and the method for infusing fluids if they were prescribed. So now I would come back later and discontinue it. So upon entering the room, I would perform hand hygiene. I already have my goggles on, and now I would put on clean gloves. So now I'm going to support the catheter and remove the tegaderm dressing, and I want to remove it towards the site, pulling towards the site. And dispose of that. Then I'm going to support the catheter and remove my tape. Dispose of that. So now I'm going to use gauze and apply it to the site and apply pressure. I'm going to slowly remove the catheter parallel to the skin and inspect for the intactness of the catheter before disposing in the sharps. So then I'll apply pressure for 30 seconds and then use tape to tape the gauze down. And while doing this, I'm going to be observing for any pain or tenderness, bleeding, or swelling or inflammation. And then I would reposition the patient to a comfortable position, lower the bed to the lowest setting, raise the side rail, make sure the coli was in reach of the patient, and then I would remove my gloves, perform hand hygiene, and I would go and document. Thank you.